Today I'm going to talk to you about a very common issue that lots of people suffer with, and that is a pain in the lower leg, in the calf muscle, down the Achilles and into the heel. It's suffered by runners, walkers, hill climbers and people in general who spend a lot of time on their feet. What the issue often is a weakness in the muscles of the calf, in particular the gastrocnemius and the soleus. So the exercise I'm going to give you is known as the Alfredson's protocol, and it's to address just that. What you'll need are some stairs, or in my case a block, and if your balance isn't very good, use your banister, or I'm going to use this strap just to help me. Now the gastrocnemius and the soleus are both involved with the point of the foot, but they have slightly different attachment points, so we need to modify an exercise to isolate one or the other muscle. Now the gastrocnemius, if I roll my trouser up, hopefully you'll be able to see, is this bulging muscle at the top of my calf. It actually attaches on the other side of the knee. Now the soleus sits underneath the gastrocnemius, but it attaches below the knee. Both of them, however, form the Achilles tendon. So the exercise that you're going to do is stand on the edge of your stairs with your heels hanging over. Now if your problem comes with an inflammation and irritation of that Achilles tendon, then I don't want you to let your heels drop below the line of the stairs. What that's doing is stretching the tissue. It is often going to aggravate the issue. So keep the heels level with the stairs. It also helps make sure that the load is constant through the muscles, so you'll get stronger quicker. What you're going to do for the gastrocnemius, keep the legs straight, don't let the knees bend, and rise up onto tiptoe over 1 second and then slowly lower down over 4. It helps strengthen that muscle in a nice explosive way and in a controlled way. So rising up and slowly lowering back down. I want you to do 5 to 15 of those depending on how irritable your calves are. If they're very irritable, do the lower end. If they're not so bad, you do the higher end, or as much as you're comfortable doing. Once you've done it with straight legs, now we're going to do the soleus, and to do that we're going to bend the knees to about 120 degrees, but the same principle behind the movement. Rising up onto tiptoes and slowly lowering back down. Rising up and slowly lowering back down. Again, 5 to 15 of those. Once you can do 3 sets of 15 repetitions of both the straight leg and the bent leg, then we're going to progress a little bit further. We're going to go onto one leg to increase the amount of weight going through the calf. Same principle, straight leg to start off with, rise up and slowly lower down, rise up and slowly lower down. Again, 5 to 15. As you get stronger, you'll be in that upper end of that 15. Then with the bent leg for the soleus, same thing, rise and slowly lower, rise and slowly lower. Once you can do 3 sets of 15 on both legs, then we need to look at adding a little bit more weight into the system. And one of the easiest ways of doing that is getting a rucksack or a backpack, putting some cans of baked beans in there, increasing the amount of weight, or books, or if you've got them, some dumbbells, they'll be just as good. And you'll repeat that exercise with the increased weight on the back. You're looking to get to about 2/3 to 3/4 of your body weight extra to really help those muscles be strong, stable and ready for anything. So that when you're walking, climbing hills or just walking around the shops, you've got excess strength within those muscles to cope with any unforeseen trips, falls or staggers. The whole process is likely to take about 12 weeks depending on how severe your injury was in the first place, but give yourself time. If you find it's not improving and there's no change within the first couple of weeks or so, then you might need some extra help, and that's where people like myself come in. So if you're near, book an appointment with me and I'll see what I can do. If not, then book a reputable therapist in your area and see what they can do. I hope you find this video helpful. If you did, give it a good thumbs up for me. And if you like this kind of content, subscribe to my channel and I'll see you in the next one. Thanks very much.